Okay. Thank you very much. Thank you very much, Felix. Thank you for hosting this meeting and for all the work that you do behind the scenes, keeping the National Olympic Committee of Zambia vibrant and running. I'm sure most of you follow our Facebook content. I'm sure a lot of you follow our Facebook content, Twitter, Twitter now called X, of course, and other social media handles for the latest on what's going on with the Olympic Committee of Zambia. So Felix, thanks for all your work there. Felix, could you allow me to share my screen?
I think you can now, Doc. Yeah, Doc, I think we can see the screen. So once you put the slideshow, you can just unmute yourself and then you'll be able to proceed. Yeah.
Okay, thank you. I was trying to. Okay, so welcome to this webinar titled Navigating the World Anti-Doping Agency 2024 Prohibited List. So that's the layout of what we're going to discuss over the next 30 minutes or so. I'll go through this content and leave good enough time to allow some further questions and deliberations on the content. So that's just a brief layout. So as you may be aware, every year the World Anti-Doping Agency publishes the Prohibited List. So the latest edition of the Prohibited List for 2024 came into effect on the 1st of January, 2024. This document is very important to us in sport and especially for us in clean sport. By the way, I am the chair of the Clean Sport Division of the Medical Commission of the National Olympic Committee of Zambia. And so we wanted to just educate officials, athletes, support staff, parents, everybody involved in an athlete's journey and in their life. So the 2024 Wada Prohibited List is a document that we must be able to navigate and we must be able to understand. It's not a big document, only 24 pages, and it communicates to us substances, also called drugs, and methods that are prohibited. In other words, if any of these substances are found in an athlete's samples, be that blood, be that urine, or them being in possession of these substances, it can result in an anti-doping rule violation. So the document is basically divided into three parts. It tells us the substances and methods that are prohibited at all times. It tells us the substances and methods that are prohibited during competition. And it tells us substances that are prohibited in particular sports. So, when the first part of the document is basically telling us of drugs that are prohibited at all times. This means, should any of these substances be found in an athlete's system at any time, they will result in an anti-doping rule violation and, of course, sanctions. So some common ones, and I've listed here, are steroids, peptide hormones. A lot of us may be familiar with EPO, erythropoietin, which mainly is used in Zambia for boosting blood levels in Jehovah's Witnesses who cannot take normal blood transfusions. Under the beta-2 agonists, we'll all be familiar with drugs like salbutamol, salmeterol. If we are asthmatics or we know people who are asthmatics, those drugs will sound familiar. They are prohibited at all times in athletes, but to a certain level. Hormones, such as tamoxifen and clomiphene, which some of the female athletes may have heard about, as these drugs are used to treat certain conditions that females mainly face. We have other hormones such as insulin, which we use in diabetics, and also drugs like furosemide, hydrochlorothiazide, which are very familiar to most of us because they're used in the treatment of conditions like hypertension. Furosemide you recognize as a drug commonly known as Lasix. Hydrochlorothiazide, you come across that known as Moduratic. I'm sure most of us have heard those names before. Then I must note that the prohibited list also makes an allowance for any substance that has not yet been approved for human use by any regulatory body. So this means drugs that are still being developed, experimental drugs. If it is not approved anywhere in the world, it is prohibited. So it is no defense to use a substance that is not yet on the prohibited list, but is under development. There are some methods that are prohibited as well. And anything that involves manipulating the blood or blood components, either by using chemicals or by repeated blood transfusions, any form of manipulating of the blood or blood components is prohibited at all times. The next is when it comes to issues of treatment. There are conditions where somebody needs IV fluids. All that is permitted is not more than 100 mils of an IV infusion once per 12 hours, except if someone is in a hospital for legitimate reasons. Also, any tampering with samples submitted for anti-doping tests is also a prohibited method. For gene and cell doping, this is now advanced, but we'll still mention it because we do have a lot of our athletes and officials who are in countries of the world where they may have access to gene sequencing and certain treatments that are used to manipulate someone on the level of their genes to produce changes that would not normally be there and make it advantageous to the athlete. Right. There are some other drugs that are prohibited in competition, and I hope people will not get overwhelmed with the names I'm mentioning, because this lesson today, this talk today, I will show you a very simple way of navigating the prohibited list. Okay, so there are things like cocaine that we've all heard about, that are stimulants that are of course prohibited. Narcotics, I've highlighted tramadol because tramadol is a very common drug in Zambia. It's a painkiller that is available over the counter. You can walk into a pharmacy today and buy tramadol and nobody will question you. So for an athlete, you must be aware that in the 2024 list, this is one drug that is a new addition. In 2023, it was not on the list, but it is on the 2024 list. So as athletes, officials, we must be aware that tramadol is prohibited in competition. You can no longer use it as a painkiller. When it comes to the cannabinoids, things like marijuana are prohibited in competition. If an athlete is using marijuana consistently in training and before competition, this drug takes a long time to clear the system. So you may stop using it 2 or 3 months before your competition and feel you are safe. But when your samples are tested, it may still turn up in your sample and be a violation. The glucocorticoids like hydrocortisone, these are things that are usually used as injections into joints of athletes who have joint pain, and they are prohibited in competition. Right. Some notable exceptions are things like caffeine and nicotine. So nicotine, of course, that is in cigarettes, caffeine, which is in coffee, tea. I know a lot of people who cannot start their day without coffee. These are not prohibited substances, but they are on the monitoring list for 2024. This basically means that we may not be surprised if in 2025 or 2026, some of these substances are added to the prohibited list. Epinephrine, which is used for treatment of colds and things like that, painkillers, these are not prohibited when used as specified by the manufacturer, mixed with pain-killing drugs. So now the other thing we have to note is in some particular sports, these common drugs which you recognize we use in treatment of hypertension, like atenolol, propranolol, are banned at all times in certain sports, such as underwater sport and in competition in golf and automobile type of sport. Okay, so I hope I haven't lost the audience with talking about the drugs. But now I'll ask you all to pay particular attention, because this is now we're getting to the part of the presentation that I need all of us to grasp, to be able to not feel intimidated at all by the names of these drugs and methods that we've discussed so far. What do we want to answer when navigating the 2024 prohibited list? We want to ask these few questions. The first question we want to ask is, are we in a competition period? Okay, that's the first Are we in competition or are we out of competition? Next, we want to know what drug is it? What substance is this? And lastly, is my sport particular? Remember, I mentioned some sports on the previous slide that at all times and some in competition, these drugs are banned at, depending on the sport that you are competing in. Right. So the first question, let's address the first question. Am I in competition or out of competition? We are already counting down to Paris 2024, and we're a little under 2 months to go. So in competition basically means a period just before midnight on the day before an athlete is due to compete. Okay, that is the in competition period. A drug that is prohibited at all times means it cannot be used whether in or out of competition. The next question, and again, something that we're going to focus on now over the next few minutes is, what is this drug that we are faced with? What is this drug? Who is the drug? What is its real name? And so when we look at these drugs, we'll have to understand a term which I'll explain. A drug basically has what we call a generic name. A generic drug is a drug that does not have a brand name yet and does not legally belong to any company. What do I mean? Let's take, for example, tramadol, the drug I mentioned that in Zambia, it's a painkiller readily available over the counter. Tramadol is the generic name of the drug. Companies that will produce tramadol will give it a name that they can sell. So they will call the drug Domadol, Zamadol, Tranquil, Tamadol, as we see in the picture. That is the trade name. It's the name the company is using to sell that drug whose actual identity is tramadol. It's, for example, toothpaste. We have Colgate. We have Fresh Mint. Okay? The product is toothpaste, but a company will decide to call it what they want. Why is this important and why am I dwelling on it? I'm dwelling on it because the 2024 Prohibited List does not use trade names. It uses the generic name of the drug. So if you are buying a drug and you want to know, is this drug on the prohibited list, you must first identify the drug's real name, the drug's generic name. Okay, so if you walk into a store and buy Tramadol and you want to know whether Tramadol is on the prohibited list, you must be able to know Tramadol's generic name. On this packet, we can see that this company has put Tramadol, TM, meaning trademark, and Tramadol, HCI, down there, which is the drug's generic name. Right. So how are we going to negotiate how are we going to navigate the prohibited list? First, we must determine, am I dealing with a trade name or a generic name? Next, we can use various internet search engines to find out whether the name you're dealing with is a generic name or a trade name. And lastly, we'll search the 2024 prohibited list using the generic name of the drug. So I'll demonstrate. Here we have a drug that is very common in Zambia called cold read. Okay, and the manufacturer of this drug has put on has put some components on what goes into cold read. It's written paracetamol, phenylephrine, and cetirizine on the packet. So if an athlete buys this drug and wants to know, am I safe? Can I use this? The first thing he has to do is now try and see whether these components show up, whether these components are appearing on the prohibited list. So what we'll do now, the prohibited list is widely available as a free download, and you can download it and basically search for these drugs. So what I'll do now is I will go to the prohibited list, or first I will open a search engine. I hope everyone can see what I am doing. And I will punch in cetirizine. So this is the ideal skill that we must pick up. Very simple. We all know how to use Google these days. Okay? So I've punched in the name cetirizine, and it has shown me that cetirizine is a brand name. Okay? And the generic name of the drug is loratadine. So I'll write down loratadine. Next, paracetamol. In order to save time, I will say that paracetamol is a generic name, and phenylephrine is also a generic name. But I've shown you how to basically punch into a search engine the name of the drug. Next, we'll open the 2024 prohibited list, and in the search bar, I will punch in, I'll start with phenylephrine. Okay, and you can see that phenylephrine, let me just move my bar. Right, and so we can see that when I punch in, so phenylephrine shows up in the prohibited list, okay? But it shows up as a substance included in the 2024 monitoring program, but is not considered prohibited. So it is safe to use. What next appeared? We know that cetrizine's code name, generic name, is loratadine. So basically, in the search bar, I'll punch in loratadine, and it does not appear in the prohibited list. The famous drug I've been discussing, tramadol. If I punch it in, we see that it appears under prohibited in competition under narcotics. Okay, so basically, this is how we'll be navigating the 2024 prohibited list. Felix, I know we have a minute left until this link expires. Is your guidance we log back in?
Yeah, I think let me just, with the minutes remaining, let me just share the link so that people can follow on the new link so that we can continue on the other side. So you can check the chat. I've shared a link, so just click on the same link and you can join the continuation of the meeting.
And this
Yes.
is a Google Meet
Yes,
link, right?
yes, yeah.
All right.
Okay.
Okay. I hope to see everyone on the other side.
Yes.
Thank you.
All right, thanks.
Okay.